Two-thirds of the world's population, over 5 billion people, lack access to safe, timely, and affordable surgical healthcare when needed. The Lancet Commission on Global Surgery indicated that an additional 143 million surgical procedures are needed in low and middle income countries each year to save lives and prevent disabilities. Additionally, 33 million individuals face catastrophic healthcare expenditures on an annual basis due to the cost of necessary, life-saving surgical healthcare. The COVID-19 pandemic has further taken a major toll on delivery of surgical healthcare, bringing even the most robust systems to a halt for extended periods and widening the gap in surgical healthcare access. Furthermore, the economic impact of the pandemic and its attendant rise in poverty has potentially translated to an even larger population being vulnerable to catastrophic expenditure. In overcoming the aftermath of COVID and in preparation for future crises, building sustainable surgical healthcare infrastructure globally is essential. Academic global surgery, or AGS, involves the application of research, education, and evidence-based advocacy towards clinical surgical care in regions of health inequities. The primary goal of AGS is infrastructure development with delivery of high-quality surgical care to all, whether in high, middle, or low-income countries or in urban or rural locations. Strengthening overall systems for surgical healthcare wherever these inequities exist requires rigorous scientific method, a dedication to training and education, and a focus on quality outcomes. With more than 80% of trainees asking for involvement in global surgery, the demand for development of programs in academic global surgery necessitates our intentional and focused efforts.
Robust surgical healthcare systems that make access to safe, timely, and affordable surgical healthcare possible can positively impact nearly all sustainable development goals. In the interest of time, we will highlight a few. Sustainable Development Goal 1 and 8, poverty, decent work, and economic growth. It is known that access to quality healthcare services leads to reduction of poverty. While insurance systems and universal health coverage must be part of the planning for surgical healthcare systems, evidence shows access to surgical services can prevent loss and stimulate economic growth. The Lancet Commission has estimated scaling up surgical services in LMICs to meet the target of 5,000 surgical procedures per 100,000 population by 2030 would require an estimate of 30 billion sterling. While currently, in absence of access to surgical healthcare, the potential economic losses attributed to surgical conditions are estimated at 18 trillion sterling, or 1.3% of the projected economic output between 2015 and 2030. SDG 3, Healthy Lives and Well-Being. 30% of the global burden of disease can be treated or prevented by surgical healthcare, leading to healthier lives. As an essential component of surgical healthcare, obstetrics and anesthesia care can prevent maternal fetal mortality and morbidities, building a foundation for healthy lives. Finally, traumatic injuries are the leading cause of mortality and morbidity in ages between 15 to 29 years. Hence, access to trauma care will save lives and prevent disability. Sustainable Development Goal 5, achieving gender equality and empowerment of all women and girls. Gender equality involves many aspects of women and girls and their lives and healthcare is an essential component of that. Preventative care, support for obstetrics and gynecological health, in addition to obstetric, trauma, and intimate partner violence, all require the existence of surgical healthcare infrastructure. Sustainable Development Goal 9, industry, innovation, and infrastructure. Developing infrastructures necessary for the delivery of safe, timely, and affordable surgical healthcare includes basics such as reliable electricity and running water. Furthermore, establishing surgical healthcare facilities will drive innovation and promote growth of industries. Sustainable Development Goal 10 and 16, reducing inequalities within and among countries and the promotion of peace and justice and strong institutions. Access to healthcare is a human rights issue. According to the 2015 report by the Lancet Commission, low and middle income countries have the greatest burden of surgical disease and the least resources in terms of surgical healthcare. In high income countries such as the United States, some of the rural regions also face severe disparities in access to surgical healthcare. Hence, developing just access to surgical healthcare must be a priority for all countries. Sustainable Development Goal 13, climate action. Studies have shown maternal and neonatal health is impacted by climate change as patterns of disease leading to disabilities are shifting. Climate change can also affect perioperative care, especially wound healing, by the way of decreasing food security and increased temperatures. On the reverse side, surgical healthcare facilities play a role in climate change as well. Anesthetic agents and energy sources can lead to the development of greenhouse gases, while surgical waste and even paper used for documentation can increase the carbon footprint. The double-sided interaction described needs research, education, and innovation in establishing surgical healthcare systems. Surgical Development Goal 17, Partnership for the Goals. Surgical healthcare ecosystem includes many dynamic fields working collaboratively to provide safe, timely, affordable, and quality care to patients. While local partnerships are key in establishing and running surgical healthcare infrastructures, global collaborations are also necessary. Development of academic programs in global surgery depend on global partners working together to set uniform curricula and accreditation criteria for education and establishment of exchange programs. Whether these partnerships are formed within the Global South or between Global South and Global North, a just and multi-directional footing is a must.
At the Association of Academic Global Surgery, we aim to establish academic approaches in global surgery to reduce surgical healthcare inequity worldwide. We envision a world where safe, effective, timely, and affordable surgical healthcare is accessible to everyone. We will engage and unify academic global surgery to cultivate and refine the teaching and administration of global surgery programs via partnerships and innovation. We will support global surgery programs in developing equitable, bidirectional collaborations and develop the next generation of compassionate, capable academic global surgery leaders in education, clinical care, research, policy, and advocacy. AAGS membership is meant to be inclusive of everyone who is involved in the care of surgical patients across the globe. We have 5 membership categories which support surgeons and board-certified physicians, nurses, midwives, therapists, allied health specialists, program managers, technicians, engineers, residents, and students, and many others. Currently, our membership consists of 408 members across 36 countries and in 100 academic institutions. We would love for you to join us. The work of AAGS is done through its standing committees listed here. Members of AAGS are welcome to join these committees based on their interests. To date, the committees have been involved in identifying the existing gaps in academic global surgery and the global surgery ecosystem. These identified gaps have been used to develop a strategic plan for AAGS and guide our future collaborations, engagement, and goals.
Since the establishment of the AAGS in 2018, in addition to building the infrastructure of this nascent organization, we've been actively working with collaborators across the global surgery ecosystem to advance academic global surgery. We've partnered in support of global surgery conferences, such as the CUGH Satellite Symposium on Global Surgery in 2021, the Incision Global Surgery Symposiums in 2020 and 2021, as well as joining the G4 Alliance for Surgery, Obstetrics, Trauma, and Anesthesia in 2021. We also formed a formal partnership with Incision, leading to AAGS providing opportunities for student memberships through Incision. In October of 2021, we collaborated with Operation Giving Back, the global surgery working group of the Resident and Associate Society of ACS, Incision, and Global Surgery Student Alliance, Incision USA, on the first Global Surgery Residency Program Fair, held in conjunction with the Clinical Congress of the American College of Surgeons. The fair featured 17 United States-based programs. You can find the booklet and slides from this fair on our website. We hope to expand this fair this year and would like to invite all programs providing global surgery opportunities for residents to join us at the next fair. To expand on our pre-existing map of academic global surgery programs, we are collaborating with Global Surgery Student Alliance to incorporate the data from their survey of the program directors in the map. You can access this map as well on our website. We have hosted 7 assemblies since the fall of 2017. The meetings have served as a medium of collaboration for the global surgery community in shaping the AAGS early on. Since the fall of 2020, the Assembly has shifted more towards a report, communication, and decision-making meeting with the AAGS members. We aim to expand the scope of the AAGS assemblies in 2022. This year, our spring assembly will be held in May ahead of the celebration for Global Surgery Day and the World Health Assembly meetings. You can simply visit our website, academicglobalsurgery.org, for additional information or follow us on social media at AA Global Surgery. We hope that you'll join us so that together we can bridge the gaps in access to safe, timely, and affordable surgical care across the globe.